Welcome back everybody to another lesson, and in this video we are looking at one of the staples of type 1 diabetes management, which is dealing with hypos or low blood sugars. Now I'm hoping if you've got this far with diabetes you're aware of what a hypo is, but if you're not, as I say, it means low blood sugars, and we have a saying in diabetes where 4 is the floor. So any glucose level below 4 millimoles per litre is considered too low a blood sugar. And the reason we get worried about hypos is because they can become quite acutely dangerous, and in very severe cases can actually be fatal. Now, fatalities are very, very rare, but there can be some problems associated with having a very significant hypo, which we'll talk about very shortly in terms of what that is. But it can really impact cognitive function, and there has been some reported cases of brain injuries to patients that have gone too low with their blood sugars. Also, the long-term effects of repeated hypoglycemic episodes or prolonged or regular low blood sugars can also affect cognitive ability, and it's quite well established that there's a link between frequent hypos and dementia and Alzheimer's. So we're quite keen to avoid them, as I'm sure you are. And with hypos, really prevention is the best cure. Now, if you do suffer a hypoglycemic episode, you will notice a couple of different distinct types of symptoms. As your glucose levels just drops below 4 and might hover between 3 and 4 millimoles, you get your bodily reaction. So this is when your body detects the hypo and it starts to release hormones to deal with it, to tell your liver to release glucose, so namely adrenaline, which helps to mobilize fuel. But as a result, you'll start to feel maybe a bit hot and sweaty, your heart rate might start to increase, you might get tingling feelings in your fingers and in your lips, and just generally feel quite uncomfortable and out of sorts. Now, that's your body telling you something's wrong. But as your glucose levels continue to go low, and there's no guarantees they will keep going lower, but as they start to get below 3 and beyond, that's when it starts to affect the brain, because the brain's being starved of glucose. Not enough glucose can get to the brain to fuel it, and so you start to get more cognitive symptoms, like you may become dazed and confused, you might not actually be able to get yourself out the hypo, and some people actually need third-party assistance to get themselves out of the hypo. So it's not to scaremonger, it's just to be aware of this, and it can happen. And generally, most people watching this video will probably have experienced a hypo in one respect or another. So this video really is just about the steps to get yourself out of a hypo should it occur, and just make sure that you're crystal clear on what to do when it does occur. So, as we say, 4 is the floor. But we know that people that experience regular hypos, or the longer you deal with type 1 diabetes, you become less hypo aware, so you lose some of your sensitivity to those hypos. So we do have a lot of patients that say, it's all right, I wasn't in a hypo because I didn't feel it, even though my blood sugar was 2.5. That's still a hypo. Clinically, your brain isn't getting enough glucose. So even though you don't feel it, that's because your body's just set the thermometer a bit lower in terms of its glucose control to where it detects that there's a problem. So clinically, still a hypo. And it works the other way as well. Patients that run perpetually high may experience hypos at higher figures above 4. So I've had patients that might feel hypoglycemic at numbers of like 10 or 12 millimoles. If they drop below that, they start to get those shaky symptoms. So as a result, they keep themselves running high. Now, the important thing to stress is, the reason they feel low is because their body's got used to running high. Clinically, it's not a hypo. So what we need to do is work towards gradually dropping those glucose levels back towards normal levels in order to reset that thermostat of glucose so they start to feel normal at normal glucose levels, because otherwise they're just going to run perpetually high, and that has its own list of complications in terms of the cardiovascular risks, eye risks, vascular risks in terms of the extremities, and the list goes on and on and on. So, really important subject, and really important to know how to treat it. So how do we treat it? So step 1 is, if you feel out of sorts, give yourself a glucose test. So if in doubt, test the glucose. And if you're using a flash glucose monitor or a Dexcom, Dexcom will alarm if you're dropping into a hypo. Flash glucose monitors like the Libre aren't as accurate at low blood sugars. So blood sugar test is still the gold standard. So always believe that over everything else. And if you are below 4 millimoles per litre, the guidance is to take between 15 and 20 grams of carbohydrate, rapid acting carbohydrates, a quick acting sugar basically, which could be something like 4 dextrose tablets, or glucotabs or Lucozade tablets. It might be 2 glucogels, 150 ml of sugary drink, so like Coca-Cola or Sprite, or even orange juice and apple juice. That's step one. We do not recommend that you have sugary foods that have fat in them, like chocolate, because because the fat in the food slows down the absorption, so you'll spend longer in the hypo than you need to, which isn't ideal. So we want to get out of it as quickly as possible. The other thing that would be appropriate is actually things like jelly babies. So you need 4 or 5 jelly babies, maybe 10 jelly beans, sweets essentially. So we're opting for rapid acting glucose. Then after you've done this, you need to wait 15 minutes. And the reason we need to wait 15 minutes is because it takes 15 minutes for this to be absorbed. Now, one of the things that we often see is a rebound high glucose level after the hypo treatment because people overdo it. And it's perfectly understandable because you feel pretty lousy, and often with hypos comes quite an insatiable hunger. So you end up overcorrecting the hypo, and as a result you get a rebound high, and therefore you need to take some insulin, which then causes you to drop again. Okay, and that's just a good point with step one. Don't take any insulin for this. Definitely do not take any insulin when you're treating a hypo. But one thing to stress then is whether you have 6 tons of sugar or whether you just take the appropriate amount, it will still take about the same amount of time before it starts entering your system. So you can just try it with 20 grams of carbohydrate and see if it helps to correct the hypo, which it should, as opposed to eating everything in sight and then having to deal with the fallout afterwards. Don't get me wrong, I'd rather you had a high glucose level afterwards than perpetually stay in the hypo, but there is a happy middle ground where you actually treat the hypo appropriately and you're not having to deal with highs afterwards. So 15 minutes later, recheck, and there's 2 things we can do. If you're still below 4, go back and repeat step 1. And keep repeating step 1 until your glucose levels is above 4. If you find that you can't get yourself out the hypo, maybe after 2 cycles of this, then yeah, absolutely, that's when let the floodgates open and have as much sugar as you want. And if you really can't get yourself out of it, it shows that you've really got too much insulin in your system, and that's when it might be an ambulance call out so they can infuse some glucose into your veins. Pretty extreme, but it does happen very occasionally. If you recheck and you're above 4 millimoles, it means you have successfully treated the hypo. But remember, the reason you've hypoed is because you have too much insulin in your system. So we need to offset a hypo later to allow for that insulin to get out your system. So we want to do a 3rd step where we take on additional slower acting carbohydrate to help just drip glucose into your body for the next couple of hours to stop any other hypos occurring. So we say take another 15 to 20 grams of slow releasing carbohydrate, which might be like a slice of toast or a banana, or about 200 to 250 mils of milk, 2 biscuits, or if you have a meal planned, eat the meal, but just make sure there's a starchy carbohydrate source on there. Pasta, rice, potatoes. We've done the video on carbohydrates, so you know what they are. And essentially, after any hypo, just make sure maybe you're a bit more militant with testing your glucose levels for the next few hours afterwards, because if you have had a hypo, it puts you at a greater risk of having further hypos throughout the day. If you've had a severe hypo below 3 millimoles per litre, then you're definitely at greater risk for the next 24 hours. And sometimes it can be due to the fact that you haven't got enough reserves in your body. And there is some incidents where particular treatment, maybe third-party assistance, they will need to administer a particular hormone to help you release extra glucose out of your liver. Now this hormone's called glucagon. You might have heard of it. It's called a glucagon injection. You get it from your GP. Everyone should have one on prescription. And the idea is that should you become unconscious, there is someone on hand to administer a glucagon injection which tells your liver to release all of its glucose to help get your glucose levels back to a normal level. Because obviously if you're unconscious, you can't eat and drink and treat it yourself. Now obviously someone else will be administering that glucagon injection. So put it in a place where you're most likely to have a hypo, if you can think about that, and make sure the person that might be administering it is well aware of what it's for. So that might be a partner or a work colleague or a friend or a housemate, whatever it might be. And just make sure they're crystal clear that glucagon is the counter hormone to insulin, because what we don't want is someone seeing you unconscious in a hypo and give you more insulin, because we have seen it done. So glucagon is kind of like that last line treatment to help get people that can't assist themselves out of a hypo. But keep in mind, because it makes you dump all your storage of glucose from the liver, that means you've got no reserves left, so you need to eat quite well for the next day or two to help replenish those stores. And that's why a glucagon injection will only work once until you've replenished the stores. So you couldn't take back-to-back glucagon injections because you've already dumped all your glucose into your system. Hopefully that makes sense. Hopefully I'm not scaring you. Glucagon injections are very rare, but we do see them misused sometimes where they are actually used when they don't need to be, because the glucose levels are quite modest, maybe 3.5, still a hypo, but perfectly treatable, and they've gone for the glucagon injection when they don't need to. The other reason I mention it is because many patients I speak to have no idea what glucagon is, they haven't got it on prescription, and everyone with type 1 diabetes should have it to hand. So if you haven't got it, speak to your GP and get it prescribed. It comes in an orange box. And it's dead easy to administer. You just need to make sure that whoever's administering it knows how to do it, or whoever's most likely to administer it knows how to do it. So there we go then. A bit more information than actually I thought I was going to discuss when I got into this video, but simplistically, 3 steps. Take some rapid acting sugar, test, either repeat or move on to the next step, and then take on some extra slow releasing carbohydrate to stop the hypo happening. So we'll leave it there for now, and we'll see you at the next lesson.